Sinead's sister gave birth to baby Megan, but Sinead will be mum. One of an army of aunts, uncles, grandparents and cousins who step in each year to bring up children when family members can't and keep them out of the care system. It's been a tough start.
I found it so hard, times when I was calling social services for support or, can they help with issues that I had with my benefits. The response at times that I was getting, it was kind of like, well, you're not our responsibility anymore. You have your order, you have your niece, you have to kind of get on with it on your own. Put it here.
Megan is one of an estimated 200,000 children in kinship care, 3 times as many as are fostered. But there's not the same level of support for their carers.
We've been working with families who actually don't have enough money to buy a bed for their children. They're turning to food banks.
This charity is warning the pandemic is putting extra strain on an already neglected group.
They're left turning to the benefit system because they've lost their income from their own work and they don't get an allowance to cover the cost of a child, like you would if the child was in foster care.
Why not?
It's the way the system is structured. We don't seem to have a system which is fair and based on the needs of children. It's dependent on the legal order of the child.
It's not just about money. Grandparents Plus are increasingly hearing from kinship carers worried about their child's mental health and behaviour. More are experiencing child-on-carer violence since the pandemic. Most kinship carers have an informal arrangement, so it's really hard to find data about them. But a growing number, like Sinead, have what's called a special guardianship arrangement made by a court order. So we asked the government about those and how many had broken down. In the last 3 years, it was an average of 257. But last year, during the pandemic, it was 350. That's a rise of more than a third. Those children have gone back into the care system. We can't know exactly why.
What are we going to do then?
Wendy, who looks after her 2 grandchildren, understands the intense pressure. She's 67 with a lung condition that makes her extremely vulnerable to COVID.
It's made the children aware of how serious things are, and they perhaps didn't realise it before. And of course that's caused them some anxieties, because if grandma's not around, who's going to look after me?
Emotional support from charity and peers has kept her going.
Just sometimes, you get so tired, and you just seem to be fighting for everything, and that's what's demoralising.
I think it's about time that the government actually stepped up and thought, we're pushing for more families to take on their loved ones. Where is the support for them? Where is the specialist services for kinship carers?
Megan only has eyes for the woman she calls mum. But beyond that, carers like Sinead feel invisible. So it's impossible to know the true scale of kinship families being pushed to the brink. Tessa Chapman, 5 News.